This is just a little demonstration. Climate change is happening. This is temperature trends over the last 30 years in Australian capital cities. You'll notice that Hobart is... Oh no, I do have Hobart on there. It hasn't been doing too badly, but Melbourne and Perth are sort of ahead of the game, if you like, in terms of increasing temperatures, and we've certainly seen some extremes happening in Melbourne in recent years. So that's just to sort of set the scene for this morning. Okay, so all this is happening. What does this mean? All this is happening against a background of Australia's ageing population. In terms of heat stress, that's quite an issue because ambient temperatures, high ambient temperatures tend to affect people who suffer from chronic disease. Older people tend to suffer from often quite several diseases. This is also happening at a time when we have an obesity epidemic occurring. So in terms of overweight, 45% of women and 60% of men in Australia are overweight. Many people are inactive. We've got a number of people who still smoke and a number of people who drink at risky levels. And all of these contribute to high levels of chronic disease in the community. Something I'll be touching on today is vulnerability in particular communities, and this is where we think about equity and disadvantage. So climate change won't affect everybody equally, and social isolation in particular has an impact in terms of heat effects. So what are we actually expecting? Well, about another 2,000 temperature-related deaths a year by mid-century. Now, to start off with, some modelling that we did a few years ago suggested that over the next couple of decades, we might actually see a net gain in terms of numbers of deaths, if you like. So fewer people might be dying because of fewer cold-related deaths. So I don't really want the take-home message of today to be a little bit of climate change is good for you, but we'll be seeing that the major impacts occurring probably in a couple of decades' time rather than straight away, if you're talking about net effects. Mostly it's older people and those with chronic disease, as I mentioned, but this could also be an underestimate. So it's based on averages rather than looking at extremes, and I'll talk a little bit more about that. It also depends on acclimatisation, which we can't really model, and adaptation action. So what are we actually going to do? These are things we don't know. So just a little demonstration that acclimatisation does occur. In different parts of Australia, people start dying at different temperatures. So in Tasmania, you get excess heat deaths at around 27 degrees. So it doesn't take very much if you're in Tasmania. If you're in the Northern Territory, it doesn't start happening until around 30 degrees. Okay, so what should we be doing to minimise the health impacts? Got a lot of happy people, some people get sick, and what we want to do is to reduce the number of people who get sick. Part of what we need to do is actually to know what's going on in adaptation research, and so I'm going to present over the next few slides. It's an audit, if you like, of adaptation research that's been going on, and a few results from that. So this is for some work that my colleague Anthony Burton and I did for Sydney Adaptation Strategy, and I'll just take you through a little bit about what's going on. So what we did was we structured an assessment around the 9 themes of the National Adaptation Research Plan. The themes of heat, extreme weather events, vector-borne disease, food safety, air quality, water quality, mental health, community and Indigenous health, and health services and infrastructure. We reviewed the literature, not only the peer-reviewed academic literature, but also government reports and so on as well. And we interviewed experts within each theme. Okay, and what we found was that there's actually not a whole lot of research going on into adaptation itself. There's quite a lot of quite well-developed research into impacts, so that's something that we're getting quite good at doing, so modelling what the impacts might actually be, but not a whole lot in modelling what we might actually do about them. One of the things that came out, and is quite obvious to a lot of people working in the area, is that even the impacts research looks largely at averages rather than at extreme events. And it's also very much looking at population averages rather than particular vulnerable groups. So a number of research priorities were identified, and I'll just touch on these. So if we're thinking about heat, which is the main thing that my group's talking about today, we do need to understand how heat affects different populations differently. You know, it's all very well having a look at a citywide or a statewide some statewide modelling, but that doesn't tell us much in terms about what we can actually do to reduce those adverse impacts. So we need to start looking at the groups that are actually affected. If we're looking at extreme weather events, we do actually need to start modelling possible extremes. This doesn't happen very easily. It's much harder than just taking an average and modelling that. So that's definitely something that needs to happen. Vector-borne disease, we need to gain a better understanding of urban ecosystems and how they work. And that's something that actually translates across this whole urban adaptation research field. Food safety and quality, we don't actually know where a lot of our food comes from, or the impact that it has on the environment, or the impact that climate change will have on our food producing systems. In terms of air quality, we suspect that climate change will affect aeroallergens, the distribution of aeroallergens over time and over space, but we're not monitoring that particularly well. There's very little work that's gone into water quality and sufficiency, so that's certainly an area that needs some help. We don't understand, once again, what's going on in terms of mental health. We suspect that a number of things are going to happen or are occurring, particularly in association with things like long-term drought affecting people living in sort of highly affected communities. In terms of community and Indigenous health, there's a little bit of research going on into Indigenous health impacts and adaptation specifically, but it's very isolated. It's not as sort of, it's only taking place in a couple of remote and one urban community. And looking at health services and infrastructure, so a suggestion is to actually model the impacts on health services and infrastructure, because this hasn't been done, including the impacts on staff and buildings. And it needs to be included in terms of health service planning, and Anthony's going to be speaking more about that later on this morning. Okay, so some things that need to happen across the board, so not just to do with urban thermal stress, but across the number of climate change health impacts, is to model and evaluate adaptation strategies. This isn't happening. We need to better understand how processes of adaptation, things like how we acclimatise and making some guesses about technological development and so on, how that's going to affect health outcomes. We'd like to avoid potentially maladaptive actions, and Nigel might be talking a little bit about that perhaps later. And it's already been mentioned, taking a systems-based approach, so understanding how things interconnect. Some obstacles to this include limited data, and of course the common complaint is the research funding structure. So actually that's one thing that we're not complaining about with this cluster. It has actually been great to have something that has been much more interdisciplinary than many, and taking less of a discrete project approach. Oh look, I have a typo. Usually I give out a chocolate frog to whoever whoever finds that, but I'll keep that for myself. Anyway, we need to assess vulnerability, resistance, and adaptive capacity. So that's one of the things that I think we need to do in terms of research direction. So there's three themes, if you like. So actually finding out what's going on and looking at smaller level, at community level, as well as at broader state level, national level, but actually going into communities and conducting assessments to see what's going on at local level, because it's possibly going to be that at that local level where adaptation actions take place. Evaluating adaptation activities, this is something that isn't really going on at the moment, but we need some way to document what's going on and to actually evaluate these things so that we can find out what is working, what isn't working, what's potentially translatable, what might be upscaled to other communities. Now we need to also understand and respond to climate extremes. So I mentioned that a lot of the work has been done on averages, but this requires the transformative thinking that Mark Stafford-Smith was talking about, which is it's about rethinking the way that we're doing things. And that it's something that's a little bit more difficult and a little bit out of what we're used to doing. But it means getting people from different sectors together. So if we're talking about climate or heat extremes, for example, we don't know at what point systems are going to start being affected. So we can look to past examples such as what happened in Melbourne a few years ago with the heat waves, where things like train tracks buckled. All these things were affected that we wouldn't normally have considered. And to really get a sense of the interconnectedness and how those things affect human health, and what we need to know is sort of at what point this happens, and how all these things work together. And this is actually, it is very complex and without precedent. We don't know at what point that we sort of hit that tipping point where you can no longer talk about, well, for every degree of maximum temperature, you get this many number of hospitalisations or death. It might be that there's a threshold point where that just skyrockets. So it's a matter of finding out what that is and what to do. And that kind of thinking really does require imagination. So this has been something that's sort of well recognised in the climate change area, climate change and health, where mitigation is avoiding the unmanageable. That's in terms of reducing climate change, so reducing greenhouse gases and actually minimising the amount of climate change that occurs. And we talk about adaptation as managing the unavoidable. Well, I would like to extend this. So if we have new climate extremes, you really need to start imagining the unavoidable. So really sort of getting people from different sectors together and actually really just, I mean, it's not the stuff of science fiction, but sort of really thinking about these things in a very different way from what we're used to. So we need to imagine the unavoidable so that we can avoid the unimaginable, which is just, catastrophic. We don't know what's going to happen. So on that very happy note, we're sort of talking about producing a climate-ready population. And this means you have a population which has low burdens of chronic disease, a population which is highly informed, and a population that has the capacity to adapt and respond to the challenges of climate change. So some work that we did recently showed that there's this really heavy reliance on air conditioning systems, personal, household air conditioning amongst elderly people living in Western Sydney. Now that's all well and good for as long as the electricity is affordable and as long as there's no major blackout caused by or that occurs during the heat. So we need to find ways around this and find new and innovative ways to create environments that are suitable for people. And a climate-ready city is one that's actually comprehensively assessed its points of vulnerability. So when we have got all those people in the room together and found out those points of vulnerability, those points of resilience and the interconnectedness between them. And at that point, I'd like to thank our research review participants, some of you who are in the room today, and again to thank the cluster for this opportunity. It's been fantastic to work with all of you in different disciplines and to actually have a chance to get your teeth into a problem. So thank you.